And in our first session, the question that we're going to tackle is, could creative aging be a possible antidote to the pressing social ill of loneliness? I am so excited to introduce Sunil Iyengar, Research and Analysis Director at the National Endowment for the Arts, who's going to moderate the session. I'm also pleased to introduce Meredith Hanley, Program Director of Community Capacity Building at US Aging, Dr. Sudha Shreeniwas, who's a professor of human development and family studies at the University of North Carolina, Greensboro. And last but certainly not least, Dr. Jill Sonke, Director of Research Initiatives at the Center for Arts and Medicine at the University of Florida. You can read more about their illustrious bios in our bio packet. I encourage you to. But now I want to encourage everyone to keep track of your questions, put them in the chat as we head into our panel. And Sunil, over to you.
Thank you so much, Susan. And it was great to hear from Pam and Teresa, two really great welcomes. We're just thrilled to be here. And we've had a lot of fun kind of talking about how this panel could go and what kinds of questions we could ask. So I'll just start us off. Again, I'm Sunil Iyengar, Director of the Office of Research and Analysis at the NEA. I'm going to be sharing just a few slides, more in the vein of public service announcements. Oops, sorry. Let's see if you can see this. I think it's, give me a moment. Okay, so you just heard about this report that the Surgeon General indeed released earlier this year. And I think that's a worthwhile question, Susan. It doesn't call out arts and culture specifically, but it does talk about community assets. And if you dig into that, that's, it includes arts and cultural organizations and artists. But I think we can do a lot more as a community, and certainly at the NEA level, to try to put a spotlight on the arts contributions to this problem, or this epidemic that the Surgeon General chose to illuminate. Loneliness and isolation. So headline here is, I think it says like the dangers, the health effects of social isolation, in fact, translate to something like smoking 15 cigarettes a day. There's a variety of chronic and acute conditions that can be associated with in terms of long-term health and longevity. By contrast, social connectedness seems to improve the odds of actually reduce the odds of getting some of those conditions, ranging from hypertension to diabetes to a range of other disorders. And also, there are also clear educational and economic advantages that are linked with social connectedness, as the report shows out. So as the report bears out. So I would encourage you to take a look on your own a chance. And I just want to also highlight the obvious. The arts, of course, are inherently social. We all saw this during the pandemic and were suffered from the lack of being able to be engaged as much as we would like with in-person activities, for example. I should just note, we just released a couple of weeks ago a report called Arts Participation Patterns in 2022, which is based on our periodic survey of public participation in the arts, where we conduct, we collect data on household level data of how people engage with the arts. So we do, in fact, see there some marked disparities in how people engage, and sadly, some steep declines across virtually every type of art form we measured in terms of engagement and participation from the 5 years pre-pandemic. We hope some of those declines aren't here to stay, but it's worth looking at the report and also understanding what it means for older adults. We've broken out some age patterns in these in arts participation, and we also will be releasing a more comprehensive report next year that will get a little more deeper into the demographic differences. But why I say it's inherently social? So we know this for a fact, right? You can think about people going to events, arts festivals, arts events in concert halls, performing arts centers, or even neighborhoods, street block parties, and things like that, or places of worship, a range of venues. And we know that through data we've collected consistently, the urge to socialize or to be with other people often crops up as, if not among the top reasons people choose to go out to engage in an arts event if they leave the home, for example. But even a lot of, there's a stereotype about creating art, which makes you think it's always in isolation. Well, in fact, a lot of that occurs not only because people may be conceptualizing an audience for their work, but actually in person with other people. There's a lot of data on that as well. So there's that. And then also the fact that over the years, the NEA has tracked some of this data through our collaboration with other federal agencies and tried to understand how arts is related to social connectedness. And I will say among older adults in particular, a few years ago, we released a report called Staying Engaged, which is based on a longitudinal data set called the Health and Retirement Study, which found that in fact, among older adults, both creating art and attending art, as it were, was linked with better health profiles overall, lower rates of hypertension, lower rates of cognitive decline, and also I believe it was there were a couple of other physical health conditions as well, better physical health conditions than those who didn't engage or engage as much in those activities, even when we controlled for other factors. Also, I should say that I had the pleasure or privilege to head up an interagency task force for about 10 years or so across different federal agencies on the arts, health, and human development. And one of the first projects we undertook, because this is of high demand from these other federal agencies, was to really understand creative aging and the health benefits. So we released a report called Building the Science Around Arts and Aging. So I urge you to take a look at that if you can. And I just want to, I said this is going to be a PSA. Those of you who are interested in learning about grants we offer in research labs, and we have a couple of past culprits on this call, on this panel actually, who've engaged with these programs. You can learn about how to study these things. I mean, we give grants to study these factors, among others, in our 5-year research agenda. And there are actually research labs and research grants that have published papers on this, and you'll hear about some of them today, on particularly around older adults and health, but even having to do with social connectedness and isolation. And I'm going to just 2 more slides here. I want to make you aware, if you don't know, there's been a kind of some reinvigoration of interest in looking at particularly music and health. Now, not to elevate one art form at the exclusion of others, but in this case, the National Institutes of Health has taken a lot of interest in investing in research in this space, and we've co-supported some research grants with them to understand music and health and neuroscience. And of course, there's a lot of applicability of that to older adults as well. In fact, WARP Foundation released, I think a couple of years ago, a report having to do with cognitive health benefits in music, particularly among older adults. And it's also apparent in this new network we've established called the Sound Health Network, which, as you can see, our partners there, the logos at the bottom, but essentially it's a partnership between the NEA and the University of California, San Francisco. They've created a national resource center, clearinghouse of research, as well as webinars and publications and other ways to connect musicians, music therapists, and health practitioners and researchers around these topics. So I urge you to look at that website if you can. And finally, sticking with music, there is going to be a great 2-day workshop, December 14th and 15th. It's going to be live streamed. And those of you who have an interest in this topic in particular, I urge you to maybe scan the QR code or get this information from us later, or you can go to our website and learn more. And NEA and NIH and others are going to be co-sponsoring this workshop of music performances, but largely research presentations and discussions to set forth a new agenda for NIH's research investment in this space. I hope it can extend to other art forms too. So with that, thanks for bearing with me as I shared my screen. I will now stop share. And now it's time to let the others in and talk to them. So the first question I have for folks is, as you heard, this question, the idea here is, can the arts be creative aging be an antidote so to loneliness? And I wanted to ask each of you, if you could talk a little bit about your particular stance to that topic in terms of what you do, either your past or current work. So I thought I'd call on you, Meredith, first, and then we'll go around. Thank you, Meredith. Any thoughts on this topic, general?
Sure, yeah, and thank you for having me. It's a pleasure to be with the group here today. as Susan said earlier, I'm a program director at US Aging, and I oversee kind of two portfolios of work, one being our social connection work, and then one being our caregiving related to work. But just share a little bit of background on my organization, because I think that helps provide a little bit of context about my perspective. But US Aging is the national nonprofit membership association. We represent and support the network of area agencies on aging across the country, as well as the Title VI Native American aging programs. I might slip and call the area agencies on aging AAAs. I don't mean the automotive group when I say AAAs. I'll try to say the full word. But our members, the AAAs and Title VI Native American aging programs, help older adults and people with disabilities and the caregivers that support them live with the goal of being optimal health and well-being and independence and dignity. And AAAs and Title VI programs, area agencies on aging and Title VI Native American aging programs serve every community across the nation. So that's important to know. There are 614 area agencies on aging and over 280 Native American aging programs across the country. And they provide a range of services to help people age in place. So that might be transportation, it might be in-home services, it might be home delivered meals. But what we're also seeing, and this has been a growing emphasis even before COVID, because it really stems back to the whole mission of area agencies on aging and Title VI programs, is that social connection piece. We know people do not thrive when they're isolated and lonely. So a lot of the efforts of these agencies all across the country, such as having meals together, we call them congregate meals, but meals together as part of your community with other people, really help to address that social isolation and loneliness. So we see social isolation and loneliness as a critical issue, not only for US Aging, but the organizations across the country that we represent. And I'll kind of tie in the arts and creative aging part here in a second. But we have two main initiatives that we work on related to this. One is called Commit to Connect, and that's a cross-sector initiative. It's funded by a federal agency, the Administration for Community Living, started back in 2020, all with the aim of addressing social isolation and loneliness and helping to connect people by providing resources and developing a network of people across the country committed to this issue. And then we also oversee another federal resource center called the National Resource Center for Engaging Older Adults. And whereas Commit to Connect has a broad focus across all populations, Engaged is really focused on the aging network. So those agencies at the state or AAA and Title VI level or local provider levels that are working with older adults and people with disabilities in their community. So we just provide a lot of training and technical assistance and outreach and resources of a variety of natures to help support those agencies in their work. But what we observe is that AAAs and Title VI programs, as do we, see arts and creative expression as an important component of their work to address social isolation and loneliness. So just for example, in a recent survey that we did when we were asking about what are agencies doing in this realm, like what kind of activities are you doing addressing social isolation and loneliness, 63% said that they're providing arts and creative engagement activities for their consumers. I think there's an array of types of things that will come up there. Maybe you can touch on that in a minute, but you kind of see this interweaving of the importance of addressing social isolation and loneliness and the methodologies of doing that with arts and creative expression being, one key prong of their efforts. So I'll turn it back to you, Sunil. Hopefully that provides a little context.
It's a great overview, and we look forward to hearing more about your group, US Aging. I think there's a lot there to unpack. Thank you. Jill, same kind of question. How do you sit in relation to the idea of creative aging as an antidote to loneliness?
Thank you, Sunil. Thanks, Sunil. It's great to be here with you all this afternoon. So I serve as Director of Research Initiatives at the Center for Arts and Medicine at the University of Florida. I also serve as Director of National Research and Impact for One Nation on Project, which is a national arts and public health initiative, and direct the EpiArts Lab, which is a National Endowment for the Arts Research Lab in partnership with Daisy Fancourt at University College London. Across all of these roles, my work sits at the intersection of arts and public health, and more, particularly in the Epi Arts Lab, where we look at relationships between the arts and health at the population level. We're more and more looking at the impacts of the arts on older adults and around social isolation and loneliness. One Nation One Project is also very much focused on social cohesion, the relationships between arts participation, social cohesion, and well-being. So all of the work that I'm engaged in recognizes that arts participation is a health behavior. Like other things that we do, like eating well, exercising, wearing seatbelts, not smoking, you know, those big public health paradigm shifts that we've experienced. We believe that arts participation is a health behavior, and that we're in a position in the United States to drive greater recognition of that among the general public. So in the Epi Arts Lab, we also recognize that the arts are uniquely multimodal as a health intervention, right? As a health or medical intervention. We know that compared to other health interventions, the arts are unique in that they provide physical, cognitive, emotional, mental, spiritual, social benefits all at the same time. And that compared to other interventions, they're low risk, they're low cost, they're enjoyable for many people. So our statistical studies in the Epi Arts Lab, again, we look at the population level. And like Sunil mentioned in his introduction, in regard to some of the data he shared, these are highly controlled studies. We control for things like demographics, geography, age, race, income, education, a lot of the things that might explain these relationships between the arts and health. But we find that after controlling for all those things, that these relationships hold up across demographic groups. And in relation to older adults, for instance, we found that in the United States, older adults are 20% less likely to be depressed if they engage in creative activities either weekly or monthly, right? We've also found in a study that matched older adults in the US who did and who did not participate in community arts groups, so specifically in arts groups in communities. And again, we looked at a range of demographics, socioeconomic, and health-related factors, and we found that participating in arts groups was associated with enhanced positive affect, life satisfaction, purpose in life, and perceived mastery, both concurrently and 4 years later. Similarly, we found that over a 7-year period, participating in receptive arts activities like going to performances and events, galleries, museums, those sorts of things, church choirs, that receptive engagement was associated with better memory. In that study, we also found some dose-response relationships, and we're seeing these across the lifespan. But in regard to older adults, we're seeing that engaging in receptive arts activities for up to 3 hours per week, but not more frequently, was associated with better subsequent episodic and working memory. And that's a similar effect to vigorous physical activity. And we're finding a lot of parallels with physical activity, and in some cases, even greater protective effects with arts activity. So similarly, we found that engaging in participatory or receptive arts activities for 1 hour a week, but not more frequently, was associated also with better subsequent executive function and language. And there have been studies conducted, population level studies conducted all over the world in several nations, that have shown that people who are older adults, people over the age of 50 who participate in the arts just once a month or more, are between 14 and 31% less likely to die early. So we know that people who have access to the arts and who participate in the arts can have better health outcomes, especially later in life, and especially around social dimensions of well-being. We've also found, unfortunately, in our studies that the disparities in arts participation that we've known about for so long in the United States persist, particularly across race and gender. And so we also understand that access to the arts is a social determinant of health. And so we're working hard to drive policy that will enable greater access to the arts. So in the EpiArts lab, much of our research is focused on social prescribing. And Sudha is going to talk more about social prescribing, but this is a system that's been established in more than 18 other countries in the world, wherein health providers can prescribe or refer patients to non-clinical activities in their communities, social activities, arts and culture and nature activities. So at the heart of this social prescribing work is the understanding that we need to connect with others, right? That loneliness is a huge, huge determinant of health, as you've heard already. And so we're working to drive social prescribing research capacity in particular so that evidence-based practice and policy can be enabled in the United States. Right now, there are at least 25 pilot programs happening in the US as well. So delighted to pause there. Thank you, Sunil.
Oh, that's great, Jill. And I can see questions already bubbling up in the chat. So keep them coming, everyone. We'll get to you after a few rounds of questions here. Yeah, there's a lot there too to talk about. I think, Jill, when we go back to you about to think about, as researchers, we're often chasing after the outcomes, but to know why that is so. Why is it that the arts and how do the arts work on people and older adults, and what kinds of mechanisms are at play here? I think that's something that would be interesting to talk about in a moment. Sudha, can you describe the work you do, and again, in relation to this topic? Good to see you, by the way. I think you're on mute. There we go.
Sure, Sunil, and I'd like to thank NASA and all the supporters for organizing this really great panel discussion and giving us the opportunity to have this conversation. I have been involved in research on creative aging, initially supported by the National Endowment for the Arts, starting from about 2015, 2016, and we did this through a community engaged lens. So it was a partnership between researchers in the university and a community arts organization. And this community arts organization is called the Creative Aging Network of North Carolina. So they had a very wonderful package of designing and delivering arts programs. They have a diverse set of arts programs. So the particular one that we were looking at is for persons with cognitive symptoms, various levels and types and diagnoses. And to cut a long story short, what we discovered with qualitative and somewhat fuzzy statistical findings is that older persons with cognitive symptoms are capable of participating in and taking up and enjoying a very thoughtful, well-designed level of arts programming, and that does enhance social connection and well-being. And it's removed from the stereotype we might often have of some very infant level activities of gluing things or stringing things together. These were very theory-based, artist designed and teaching artist facilitated arts programs. This was called Art Mail, and it connected pairs of people together to jointly create art. So that was shown to be beneficial in many ways. Thereafter, the research that we are engaged in now is examining exactly what Jill introduced, the concept of social prescribing. That is, using the healthcare system where healthcare practitioners literally write a prescription for their patients to participate in some kind of non-clinical, non-pharmacological activity. This can be exercise, it can be healthier diet, it can be various social groups, it can be nature immersion. I mean, all the things that Jill had just been describing. And we are examining to see whether how this works in other countries, specifically for arts, and what lessons we can learn for the US healthcare system. And how, because although the US does not have universal health insurance for all citizens, over 95% of older adults are covered either by Medicare or Medicaid or some type of health insurance. So it would be good to see whether that system can somehow be used to promote arts on prescription for older adults.
That's great, Sudha. And very helpful to talk about this too. We'll get to social prescribing as well in a moment. Meredith, I just wanted to know a little bit, it was interesting, Susan pointed out in her intro that, the report, the advisory I talked about too, the Surgeon General's report on isolation and loneliness, it actually makes it look like actually the problem may be worse or more acute for younger adults than for older adults. But from your perspective, can you say anything about what you know about social isolation and loneliness, what that looks like right now for older adults in general in this country and why it's a problem?
Yeah, absolutely. Thanks for the question. So, and I'll provide just a little bit of context, I guess, here as I start, but because sometimes we use the term social isolation and loneliness interchangeably. A lot of times you kind of refer to them, or they're referred to as a package deal. And I think that is important because they are different terms. So social isolation would be the quantifiable lack of relationships or infrequent social contact. And then loneliness is really more the perception of how you feel about your social relationships, the perception of feeling alone or lonely. So it's kind of like the old saying, you might feel lonely in a group of people. That's I think what those definitions point out. You can't feel lonely, but be married or live with people, for example. And social connections, kind of this umbrella term to represent the multiple ways in which individuals can connect, whether emotionally or through behaviors or actions that they take or things of that nature. And US Aging, we oftentimes use the term social engagement. We have the National Resource Center for Engaging Older Adults. So we really look at that as social engagement, one of the avenues to help build up your overall umbrella of social connection. So you might participate in community arts programs, for example. But I do think this convening is so well timed. I mean, the COVID-19 pandemic, I think, shone a spotlight on the importance of addressing social isolation, loneliness. I think we've all probably felt isolation or loneliness at our lives in different times. I think the pandemic really brought that to the forefront for many of us. But this was an issue that existed before the pandemic. And I think, unfortunately, we're seeing that it's an issue, beyond the pandemic as well. And I think it was so important that the Surgeon General released that advisory in May. And these are really important documents. I mean, there was a Surgeon General's advisory on smoking. I forget, the decade, was it the 50s? But that helped change the culture for how we see smoking and the health impacts of smoking. And so I think this national strategy has that same potential to impact. And I think one of the things that advisory pointed out is that this isn't just an individual issue. If you feel lonely, it's not that you're doing something wrong. So many of us have these feelings of loneliness or isolation. It's really a kind of systems issue. And so we all have a seat at the table. And I'm sure there were various sectors that wanted to be maybe called out more in that Surgeon General report. But I do think when the report says something like we need a movement to mend the social fabric of our nature, and it will take all of us, individuals and families, schools and workplaces. I think this is where arts and other sectors can fit in so well too. But in terms of some of the data and specifically on older adults, one of the polls that we tend to track, follow to see, because they do really great work, is this poll out of the University of Michigan. They do a national poll on healthy aging, and they were tracking feelings of loneliness and isolation prior to the pandemic, and then during the pandemic, and then after. And so, and it's on healthy aging, so it's population ages 50 to 80 that they're looking at. But before the pandemic, it was 27% of respondents felt isolated from others, some of the time or often. And then that number skyrocketed during the pandemic. But interestingly now, this latest number came out early in 2023. It hasn't returned to pre-pandemic levels. And I think we do see higher levels of loneliness or isolation in certain other populations. But I don't think that should diminish the impacts that older adults too face with this. And also when you look at the health impacts of isolation and loneliness, I think this is important across populations. And as we age, there are more risk factors for lack of social connection or experiencing isolation or loneliness. It might be a greater likelihood to live alone, perhaps as spousal or family relationships change. Dealing with chronic health issues, which can impact your mobility, or cognitive issues, as I think Sudha was mentioning. So so those all can impact your I guess likelihood to experience social isolation or loneliness. And again, I think the health impacts are so critical. I think we'll talk a little bit more on that in another second here, another few minutes. But these numbers are real. And it's not only about how you feel, it's also about your physical health too.
Yeah, I think those differences you have to realize also those differences become magnified when we talk about layering other variables on this. So, people from certain races, ethnicities, historically underserved populations, hard to, remote rural areas, and all these other factors can, and on top of that, older adults, can really I think also, as I said, multiply or amplify the effects. That's really interesting. I'm gonna, before we go to Jill for another question, I did have to ask you, Meredith, you mentioned arts. It was great to hear that data from you about, what was it, 63% of your members or something like that use arts kinds of programs or interventions. Are there any, and not to put you on the spot, but are there any have you seen examples of any innovative or kind of effective arts practices that have come to you across your desk in terms of the work that's being done there?
Yeah, definitely. There are quite a few I've heard about. And one thing I'll mention for the National Resource Center for Engaging Older Adults, I put the link in the chat a few minutes ago, but one of our activities is that we manage a online clearinghouse of social engagement programs, and it's filterable and searchable, and you can filter it by different things. One of the settings is arts and creative expression related programs. And so we have, a whole batch of programs in that Innovations Hub that come up when you select that filter. There are about 80 programs listed in the clearinghouse currently. Oh, thanks for bringing that back up in the chat. But just for example, there was the Central Vermont Council on Aging. That's an area agency on aging in Barre, Vermont. They created the Creative Care Kit project in 2020. I think that was in response to the pandemic, but they were working to bring arts activities to homebound older adults and helping to enhance that social connection through the arts. And so it wasn't just kind of sending an art kit to the home. It was also engaging with volunteers, creative companion volunteers who were completing the same activities. And so they were allowed to kind of engage in these arts activities together, dialogue about them. And I think this group also partnered with the Vermont Arts Council as they were working on that project. There was also the earlier, I think when Susan was kicking off this session, the intergenerational angle, which we think is so important. There's so many opportunities to connect across generations, and we do see social isolation and loneliness affecting across generations. So there was the Appalachian Agency for Senior Citizens, that's in rural Virginia. They created a program called Art at Your Own Pace, and it was initially focused for people living with dementia, and it involves art therapy and other art activities for older adults to engage and express themselves in different ways. I think that's particularly helpful sometimes as you are having cognitive changes. But since that time, it's also evolved into an intergenerational program, bringing together their local adult day and their a local childcare program, so the older adults and children engage in art projects together. Being at adult day, that does tend to be focusing on older adults with more physical needs in terms of kind of assisting with certain daily activities. So that would be a program that focuses on that cohort of older adults. We also, we do have other programs where it's more collaborations with senior centers. There's a group that offers arts instruction at their local senior centers, and then at the end they showcase those the art that was developed in a senior art gallery. Again, a great way to bring community together, showcase the art of this population. I don't want to
Right.
ramble on too long, but there's so many also like dementia-friendly efforts and other things. There's so many examples out there, but the Innovations Hub has a lot of these listed.
Yeah, no, this is great. And we've seen so many innovative programs in the realm for healthy aging, as it were, healthy adults, as well as for those with in facing cognitive declines, as well as motor skills and neurodegeneration. A lot of great programs out there. And I'm so glad you advertised in a way for the National Resource Center that you have. I think that's really important. We'll get back to you, Meredith. Jill, I was also glad, by the way, Meredith brought up the intergenerational kind of benefits. That's really powerful. Jill, you really shared some great work that we're aware of, and you put in the link in the chat in response to others. You dropped the link, sorry, about some of the studies looking at these large populations over time and understanding the benefits of the arts. If you have any other study findings you'd like to highlight, go ahead. But I also wanted to ask you, and I know we talked about this a little before, just the question, why the arts? Do we have a good understanding of what's called the mechanism of action for the arts in older adults in particular, and how it increases social connection?
Yeah, thank you, Sunil. As I mentioned, I think one of the key mechanisms is that multimodality of the arts. They really are unique and provide so many benefits at the same time. But one of the findings that we've come across recently in one of our studies is that receptive arts activities can be uniquely beneficial in regard to well-being for older adults. We had a study published recently that showed that unadjusted, and I want to be really clear that in our unadjusted comparison, we found that older adults who engage in receptive activities just once a month or more are 80% more likely to have healthy aging over a 2-year period of time. And healthy aging in this study means the absence of a chronic disease and good cognitive, physical, and mental health. Once we adjusted for a lot of variables, that effect size was attenuated. It was attenuated when we, based on a reviewer's comment, removed reading for pleasure from our analysis. So I still think it's important for us to talk about these findings, because reading for pleasure is absolutely engaging in the arts. And in this study, we found again that receptive arts activities are uniquely beneficial, and we identified some potential mechanisms there. We recognized that receptive arts activities like going to concerts, performances, again, festivals, it doesn't need to be big, expensive institutional things, but going out and engaging in the arts, whether formally or informally, to take in performances or exhibits, gets you out. So mobility is one of those mechanisms that's at play. We also suggest that social engagement is a really critical mechanism here, because as opposed to when we're making art and engaging in art, we're kind of head down and around the visual arts in particular, or writing. I mean, some participatory art forms are by nature social, like dancing and music. But I think some of the lower hanging fruit around, socially based arts activity for older adults enables socializing during those activities in a unique way as compared to participatory arts, whether it's walking to the place together or talking about what we just experienced together, right? So we feel like mobility and social engagement are key mechanisms around receptive arts activities for older adults. And again, when we think about that dose response, most of our findings, and most of those in the UK, show a once a month or more as a sweet spot, or weekly, right, for arts participation, and to yield those sorts of benefits.
That's great, Jill. And as it's almost in kind of an inevitable topic when you start talking about people's lifestyles and habits and how they incorporate the arts in their lives, about ways to make the arts more accessible and to incentivize healthcare payers perhaps to think about how they can incentivize rather these healthy lifestyles, if in fact, as you're suggesting, the arts may be part of the social determinants to health, part of that framework. So thinking about that, about, kind of incentivization. I know it's early days still with social prescribing in the US, but I was wondering, since you did mention it, you could talk a little bit more about the opportunities that are presented by social prescribing to this population, perhaps in the US, based on some of your work, perhaps putting on your other hat. And maybe you could tell people about your other hat with One Nation, One Project, which you mentioned at the outset.
Yeah, thank you, Sunil. Yeah, so social prescribing, I think, is a really exciting opportunity in the US today. And again, Sudha is doing amazing research in this space. We have collected right now, I think we've completed 19 case studies of pilots in the United States. And we've got a few more on deck. We're doing social prescribing implementation science studies. And there's a lot to unpack around social prescribing, right? It's not a magic pill, but I do want to recognize that in the United States, it's not new. Our health systems, CMS, Medicaid, Medicare, have been allocating dollars to social determinants of health. And again, thanks to the person in the chat who mentioned, we are in our publications using the notion of social drivers of health. There's changing language in this space. I feel like it's important to keep the social in the equation. Social services are stigmatized in the US, have been historically, and I think that's part of the issue. But when we build social prescribing in the US, I think it's important to recognize that there have been social prescribing programs in our health systems for decades, but they're actually limited to what has been referred to as social determinants of health, things like housing, food, transportation, the things that, determine health outcomes. But when we look at the social prescribing movement worldwide, it's really centered on the idea of social engagement, recognizing that loneliness is a massive determinant of health, right? And so it focuses on prescribing and referring people to socially based activities, community-based resources. So I think that's incredibly important. One Nation, One Project, as you mentioned, Sunil, is a national arts and public health initiative building on the Federal Theater project that happened after the Great Depression in the WPA. In One Nation, One Project, 18 cities across the United States, including Hawaii, are engaging the arts and artists very centrally post-pandemic to rebuild our social fabrics and to rebuild health and to demonstrate that the arts and artists are critical to building health in communities. And we believe that social cohesion is an important mechanism in that. We believe that there's a direct relationship between arts participation, social cohesion, and population or community level well-being. So we're studying that program nationally, and keep your eyes open. July 27, 2024, there will be a huge national expression of all of these beautiful local narratives around arts and health.
That's just great to hear. So you heard it here first, folks. July 27th, great. Sudha, I'm wondering, in light of that comment, and I'm glad that Jill noted it's not a silver bullet, it's not a panacea, social prescribing, but from your, since you are studying this right now, I understand, in terms of older adults and social prescribing, I don't know if you've discovered anything so far, or can you tell us anything about the so-called promises and perils of social prescribing among older adults? That'll probably be my last social prescribing question, everyone. Sorry, you're on mute.
Yes, I'll drag social prescribing back into the conversation, even if you put it out. But it was very interesting for me to hear how Jill described that social prescribing in the US is not new, and it has been focused on social determinants of health, because the way it has been described to us and the way the written work describes it in countries like UK, which is one of the pioneers, in Canada, which followed soon thereafter, that social prescribing was related to two issues. One is this long recognition of the pandemic of loneliness before the actual COVID pandemic. And also that because of loneliness, anxiety, and certain broad mental health conditions, people were making repeat visits to their primary care practitioners. for issues that were not really clear cut. And so the practitioners kind of felt they were somaticizing their conditions of being disengaged. And the social prescribing, particularly for arts movement, sort of came in relation to that. But at the same time, many of the people who have commented have mentioned that social prescribing is also being promoted in an era of funding cuts for healthcare systems and funding cuts for other social benefits across many of the countries. So it's like, if you do social prescribing, you're going to get all of these benefits for a lower cost. But social prescribing cannot address the other systemic social determinants of health, like lack of housing, like homelessness, like poverty, food insecurity, a whole host of issues. So those are some of the promises and perils of social prescribing. And in addition to that, if social prescribing for the arts, I mean, I was so interested to hear all of the findings as shared by Jill and as the issues shared by Meredith, that there seems to be so much evidence that there's actual money being saved and there's actual health benefits to the extent that it's as good as exercise or better. You engage once a month or once a week in either receptive or participatory arts, and then you're having fewer chronic health conditions and improved cognitive function. I mean, that is, to me, amazing, because it would be so great, and I'm sort of going to go down to my notes, give me a second here, that that the medicalization of the arts can be a contested area. But before I even say that, what I would say, it would be so wonderful if the healthcare system could recognize that there are certain healthcare dollars saved due to arts participation, and then to divert some of that funding saved to supporting the work of community arts organizations who are providing arts programs for older adults. There is a model for this sort of kind of some of the Medicare Advantage plans. I mean, there are pros and cons to Medicare Advantage plans, but some of them have provided subsidized gym memberships and access to online exercise classes and health coaches through programs such as Silver Sneakers or Renew Active. And it would be really interesting if that type of model could be applied to arts participation through community organizations for older adults. But then that raises a whole issue of funding models. I mean, there's two things. One is the medicalization of arts being sort of an area of, for people to discuss. And another is what infrastructure is going to be needed if arts participation for older adults were to be scaled up and applied as an antidote to loneliness. And I think the audience in this webinar would be absolutely the people who recognize what it would take. First and foremost, you need funding. You need increased staffing. You need increased record keeping, particularly of health-related issues, because you may have to keep demonstrating that your programs are effective in some sense. Then you need a lot of training and upskilling of teaching artists and of community arts organizations to work with people who have medical diagnoses, who have been funneled through the healthcare system. Now, that's a big ask. And things like patient confidentiality, all sorts of things. And that's a big ask for people who did not choose healthcare as a profession. So that's another whole area. And so there's and then one thing we didn't talk about is what happens, the nuts and bolts of social prescribing or arts on prescription, if we're focusing just on the arts aspect of social prescribing. How this works is a patient goes to their healthcare provider, who then determines that they might benefit from something that is more connected and more arts focused, and they write them a prescription. The patient is then handed off to what the UK and Canada call link workers, which are like patient navigators or patient activators. Link workers are unique professionals who have a lot of local in-depth knowledge about what is available in that area. And the patient then spends a lot of time with the link worker so that they get to know each other, and the link worker is able to suggest some options for the patient that may be acceptable, available, accessible, affordable, all of that. So there's sort of two big funding needs that shows. Number one is link workers need to be trained and compensated accordingly because they are overworked and underpaid linchpins of the system. And then the other thing is funding for arts organizations to meet the needs of like lots more people coming in the door. In UK and Canada, link workers are partially paid for through the healthcare system. Healthcare practices can apply for funds to have a link worker on staff. In Canada, it's more ad hoc across different provinces. It doesn't cost, once a sort of a fact sheet has been developed and disseminated to healthcare workers, it doesn't cost anything extra for them to write a prescription. So link workers then cost money. But then what really costs money is how do patients actually pay for and participate in arts programs? Are they paying from their own pocket? Insurance right now is not covering really much of that. In the UK and Canada, it's this big ad hoc system. The arts organizations, as it is, are constantly scrambling for funds and grant writing. They have to then do additional grant writing to support these increased activities.
Right.
And the healthcare system is not paying for community arts organizations in any place, which is why earlier I had said it would be really good if it was clearly demonstrated that arts participation saved the healthcare system some money. Wouldn't it be wonderful if a little bit of stable funding stream, some fraction, could go to healthcare organizations? So I leave that issue of the medicalization of the arts aside for a minute, but I'm hoping that this is giving some answers to it.
It does give us a really great amount of detail to understand this better, Sudha. And I was thinking, yes, cost benefit analyses and cost effectiveness studies, I think, are going to be key to, as a sort of and at some threshold of evidence that can then be used to move the needle on this. So totally agree with you on that. I'd like to, I've been kind of going around asking questions, and people have had resources at the ready, and it's been great. But I want to ask any of you, if you had questions of each other, my illustrious panelists, or any comments to make on anything that, now that you've heard your fellow panelists speak. I do have one more question before we go to the, and I'll do a rapid fire closeout before we go to the Q&A, and there's some really good questions in the chat. But meanwhile, I'll just open the floor to you all if you have any questions among yourselves or comments.
Can maybe jump in with a comment. Please. Or a thought. I'm not sure how formalized this thought is yet, but Sudha, just with what you were saying about the data collection element and needing to show perhaps or collect data that could show that some of the health impacts of these types of classes or interventions. And I hope I'm not jumping a gun with a final question or anything, but I do think that could speak to some interesting opportunities with partnership. Because what we see with agencies like the area agencies on aging and the Title VI Native American aging programs, they are doing assessments on a variety of things, but related to, health status and chronic conditions and levels of isolation and loneliness too. So it might be interesting. And I think with information exchanges, there's always, need to be sensitive of people's information and such. But I do know there are partnerships where information appropriately, and with the right precautions in place is shared. So I'm just wondering, I feel like maybe partnerships in that area could come into play.
Push that a bit. What kinds of partnerships with what kind of entities do you think? So, for example, arts organizations or arts, arts based organizations are the ones kind of seeking these kinds of entry points. You think it would be with, like, not to name your group specifically, but something like US Aging or an aging services provider? Is that what you're thinking?
Yeah, I mean, we at the national level, we can always help to make introductions, but I think probably the actual relationship would be at the local level. So if there's like an arts council or an arts association, and they're looking to make an inroad in reaching the aging population, the AAA is a great just kind of inroad. We do tend to serve older adults of greatest social and economic need. So I think just, kind of, but AAA's partner, they typically have at least 25 other partners in their community that they're already engaging with in the aging sphere. So I think that could just be a good opportunity. And senior centers, I mean, AAA's worked with the senior centers. And so just like kind of connecting to other community sites that can offer these interventions, perhaps collaboratively.
That's a great, that's a really great observation, that partnerships are really the key forward. And that's particularly keeping in mind the fact that how are older persons supposed to afford these arts programs? And there are many people who are not that connected with the healthcare system, either due to income or living rurally, or if they are in, not English speaking. There's a variety of ways in which you're not connected in any way. And as a result of that, you're being left out of these conversations and connections. So I think, and certainly senior centers and area agencies on aging have certain gaps with regard to reaching under marginalized and underserved communities. So that could be a way forward, is for them also to build partnerships with community nonprofits.
Yes.
Jill, I think you were going to say something too. That's great, Sudha.
Yeah, I would just add absolute agreement with the critical nature of partnerships, cross-agency, cross-sector partnerships, local recognition of artists and arts organization as available resources to address health issues and priorities in communities. I also think there's a parallel priority for facilitating in the US general public understanding of the health value of the arts, right? When paradigm shifts happen, there's all the ingredients are necessary, right? Research, policy, activism, communications. I think communications around normalizing our understanding of the relationship between the arts and health is critical. Social prescribing has an important place. And I think if social prescribing comes to bear nationally in the United States, we're just going to see massive increased demand for the arts and what artists do, right? And everybody won't need to go through the healthcare system, but as the healthcare system helps people understand the relationship between the arts and health, people will go directly to the arts resources in their communities and in their homes, right? In the United States, we uniquely separate the arts from the fabric of our lives. We sort of other and make special and luxury the arts, and there are a lot of barriers, we know, again, across race, age, geography, gender, those sorts of things. So I think at parallel, we need systems, we need programs, we need communications to help people just recognize the available resources that we have in our lives around the arts and creativity.
So glad you said that, Jill. Sudha, I see your hand up. Maybe we'll just take that, and then I really do want to move to questions I see a couple of questions I'd like to get to. Thank you very much.
Okay.
Go ahead.
Thank you. Thank you, Sunil. I had a question for Jill. You had mentioned dose-response relationships of arts participation and well-being. And one of the questions we are thinking around is, how do you see arts participation in relation to promoting well-being? Is it that, okay, go for these 8 classes once a week for 2 months or something, and then thereafter you carry on your own, and that's the social prescribing component. You prescribed 8 classes and thereafter people carry on their own? Or is it like you stop there? Or is it like a lifestyle change, like exercise? This is something like exercise you're supposed to do all the time, be creative. So how do you see that, and how do you
what's the answer, Jill? We want answers. No, this is a good question.
It is a great question. I mean, we are seeing, and I will mention that the dose response stuff is really interesting. We see in different things in different age groups. So sometimes in younger people, we see, more benefit weekly than monthly and more benefit daily than weekly. And in some situations, we see more frequent participation limit the benefits because we wonder, can art become work as well, or are we hearing from people whose work is the arts, or there's just a lot of questions in that. So we're still being very cautious with the dose response relationships, but we can see them statistically, right? And these are studies that associate, they're not causal studies, right? They create associations. So I do think that's really important. I think, Sudha, that just like, I always use the analogy, how many of us on Sunday night are like, okay, when am I going to run this week, or get to the gym, or get to my yoga class, or whatever the things, because I know like 3 times a week is kind of the basic, right? For exercise, we're being conditioned around the regularity of exercise. I believe that the regularity of creativity and of arts participation has benefits as well. So in other nations, we're seeing social prescribing or arts prescribing being like an 8 weeks thing, or a 12-week prescription, or a 6-week prescription. In the US, we're seeing a broader array of models that are a little bit less time limited, which I think is really interesting. So I think your question remains to be answered. It's a really good one.
Yeah, it is a good one. All these are great questions. I think, honestly, as we think about access in particular and that dimension and how that might limit the opportunities for exposure. Somebody in the chat noted, for example, about how, of course, dementias can mitigate someone's opportunity to create art, and they may be more in a passive or receptive role, ideally, but maybe not able to create as much, or in some cases they can. Sudha, contradict me. Oh, you're on camera. Oh, sorry. Sudha, were you going to say something? Oh, sorry. I thought you were going to say something. Okay, well, so I have a question.
Yeah, I disagree. Sorry, I don't.
Oh, please
I
do.
disagree that dementia reduces people's capacity to create art, because that Art Mail program that I talked about in 2017, 2016 worked with patients with cognitive, who had symptoms, and at varying cognitive levels, they were able with that facilitated setting, able to create, using the framework of abstract expressionism, were able to collaboratively create amazing art and just come out of that room with fantastic participation. So it's possible.
Great. I'm so glad
with visual impairment were able to create art. It was just fabulous.
No, it's so important to know. And we've heard similar things with rhythm, of course, and music. So let me just, one question I have from somebody is, can the panel address if there are differences of how different age adults access the arts and address loneliness and isolation differently by generation and years of birth? So, for example, if you were thinking about this in terms of generational cohorts of baby boomers or the silent generation, et cetera, have you seen anything in the science or maybe anecdotally that tells us something about how different age groups among older adults, depending on generation, might kind of respond to these kinds of interventions? I don't know if we have data on that.
Danielle, I'm thinking you might have this information.
Well, now that you mention it, well, we've seen a lot about participation patterns and what types of arts behaviors, if you will, different generations cluster in what groups they cluster in. We haven't seen so much, though, and we haven't, to be honest, looked enough at how those factors are affected by how arts and health benefits, or the health benefits of the arts, might be felt or sustained differently by generational groups. So sadly, I don't have a lot to say about that really excellent question, but I think that needs to be considered, because clearly a 60 and older person of Generation X is quite different from one from the baby boomers and so forth.
No, can I just, that's my question. Can I just
sure, please, Alan. Thank you.
I'm going to be 70 years old. Okay, I'm smack in the middle of the baby boomers. Okay, and I have been working with older adults from the time I was very young with my grandparents. Okay, the time I was like 6 years old, and I'm still engaging with adults. As I get closer in age to the people that are being served by many creative adult programming, I am finding out that their engagement in their behaviors are very much similar to what happens when kids 10 years old to 25-year-olds are so involved emotionally in what they're doing, and they're constantly going back to that period of their time, especially when they tell stories. All those songs, and I'm a music person, all the songs are the things that you were used to hearing when you were like 10 to 25 years old. You're in that little compartment. And now as we're getting older, not only is technology giving us access to so much more information and music from different styles, different genres, we're also finding that the older generation wants to tell their stories, and the way they tell their stories is through the arts. And I find it's a great piece. I'm very curious to see what's going to happen with the social networking. And as you know, there's so many difficulties going on with kids now, with a lot of emotional and mental health problems because of the isolation and everything else. There's something that can be learned from how they're going to overcome that to what adults are overcoming their isolation. Just those were thoughts that I had, as that's where the question is coming from. Thanks.
No, it's really great. And Alan, maybe I could send you some stuff offline if I can unearth it. No, this is great. Well, so we also have a question here, and I'm not quite sure to whom it might be addressed. It says, how do I help senior students remain focused? And how to distinguish the difference between losing focus and feelings of loss and thriving? That's interesting. And any suggestions of art projects which would help both? So kind of distinguishing between people who don't want to stick with it or aren't able to focus perhaps on the program being offered or participating in it. And then on the other hand, their feelings of loss of thriving. Any thoughts on this general question? Or perhaps the questioner, if you want to elaborate?
I would just offer that, that's a very specific question. And I think programs like Time Slips have developed a lot of expertise around facilitating the arts for older adults. Their training program is really great. Much to, I think it was Alan, your point, storytelling is such a beautiful art form, and Time Slips focuses on storytelling quite a bit. So their training program and resources, I think, would be really helpful. Similarly, there's programs like Dance for Ph.D, Dance for Parkinson's disease, which is generally for older adults as well, that provide great training as well.
This is such a rich conversation that I know could go on for a long time, but I am really sorry to have to say that we have to bring it to a close, because it is time to move to our intermission and set up for our next session. So with apologies, Sunil and Sudha and Jill and Meredith, thank you so very much. This conversation really gave us such a great frame to kick off our whole Creative Aging Institute this year. And your expertise really has just added so much to our learning already.